Welcome, everyone. Thank you for joining us in today's webinar, The Role of the Workplace in Promoting or Hindering Physical Activity Outside of Work. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be moderating today's webinar. We thank our academic team and our 9 founding partner organizations in the Harnessing Talent project. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges is a 3-year project funded by Employment and Social Development Canada. If you would like to learn more, please visit our website at harnessingtalentalliance.ca. This webinar is made possible through the support of Employment and Social Development Canada, as well as donations and memberships to WWI. We thank our advisory committee and speakers who contribute to this webinar series. So while we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing, any comments you may have, and any questions related to the webinar. We will collect questions submitted throughout the webinar and follow it with a Q&A based on the questions submitted. Please note that the Work Wellness Institute is recognized by the Society for Human Resource Management, SHRM, to offer professional development credits, or PDCs. This program is valid for 1 PDC for SHRM CP or SHRM SCP. Our institute also offers accreditation recognized by VRA Canada. If you're a WWI member or a VRA Canada member, you receive free certificates of attendance. Otherwise, there is a $15 administration fee. We're very excited to welcome Dr. Avi Biswas with us today. Avi is an associate scientist at the Institute for Work and Health and an assistant professor at the University of Toronto's Dalla School of Public Health. Dr. Biswas conducts health promotion research at the intersection of work and health. His emerging research program includes examining patterns of physical activity at work and outside of work and the associated cardiometabolic benefits, and research to inform efforts to integrate workplace health promotion with occupational health and safety in Canadian workplaces. Avi, thank you for sharing your expertise and insights with us today. I will hand you the floor without further wait.
My pleasure. Thank you, Yusra, and thank you to the Work Wellness Institute for hosting me, and thank you all for tuning in today. Everything was a little bit of my bio was covered right there by Yusra, and I just thought I'd share a little bit more about myself and what really motivated me to do this kind of research. So my background wasn't always in work and health research. I started off doing research on clinical populations and looking at how clinical population of cardiac rehab patients, so people who have undergone a major cardiac event, so a heart attack, a stroke, and go through a rehabilitation program. And this program is typically multi-component, includes education, social work, lifestyle courses and classes, but at the crux of it is exercise. And patients go through a program of exercise training in order to really boost the strength of their heart. And so with this program, my work had been, a lot of it had been quantitative, but also qualitative. So asking people their experiences in terms of getting people to, getting themselves to move more. A lot of them hadn't been moving as much before, and they were having to really change their behaviors. And common response I was getting was, I can't move as much because at work I have to be in front of a computer. I have to work, I have to focus, I don't have time, my boss won't give me time, or it's just not, my workplace isn't designed to really help me be engaged in physical activity, or even be engaged in physical activity outside of work. And so that was really, I think, the motivating factor for me, was that, we have a sizable proportion of the Canadian population engaged in the workforce. And, a third of our day is spent at work. So why aren't we thinking more about using the workplace as an effective promotion tool to get people to be engaged in more physical activity outside of work? And so that was really the crux of kind of part of my research at the Institute for Work and Health. And I'm here to share findings from 3 studies and to give you some recommendations to work with as well, if you're looking to be more physically active outside of work, or to have your colleagues or other employees engaged in more physical activity. So if I was to tell you that you can take a pill, you can take a pill 3 times a week, and if you take that pill, you can lose weight, you can increase your confidence, boost your self-esteem, reduce your risk for heart disease, lower your cholesterol, reduce your risk for diabetes, Alzheimer's, osteoporosis, increase your strength, feel better, think better, reduce your risk for all kinds of cancer. Well, there would be lineups, outside every pharmacy, out of every doctor's clinic for that pill, right? And that pill is exercise. Unfortunately, that pill isn't taken a lot because you have to work for that pill to actually work. You have to do things. You have to, motivate yourself to get off your chair, to get off your couch, and engage in exercise for at least 30 minutes of heart pumping exercise. We call it at least moderate to vigorous intensity activity for about 30 minutes a day for about 150 minutes a week. You can get those benefits. Repeated studies tell us that that is a really effective medicine and therapy for a whole host of that provide a whole host of health benefits. And we're not taking this medicine as well. And there's a lot of factors that might be why it's not as well attended, as well prescribed as a therapy. And you can see that in Canadian adults. So this is a graph of a representative sample of the Canadian population shown over time, in times of their lives. Okay, so I'm just going to have you look at the green columns first. And so what they did, this is from a survey from Statistics Canada called the Canadian Health Measures Survey. And what they did was they had a representative sample of Canadians, representative being representative of the whole population across all provinces, and they had them wear a activity monitoring device on their waist. And so the reason for that is that it provides us, researchers, with best measure of what people are actually doing in terms of their physical activity, as opposed to if they were just reporting and telling us what they were doing. That can have its own biases. So if you focus on the green column, that's the overall Canadian population that was sampled, or the population that was sampled as a representative of the overall population. And we see that from 18 to 39 years of age, on average, people are most physically active. They're spending about 27 minutes of their day in at least moderate to vigorous intensity physical activity. So what we want to be doing, right? So about 30 minutes a day, up to 150 minutes a week. We're finding, though, that gradually decreases. It decreases as we get older. And unfortunately, as we get most frail, so as we approach retirement, as we exceed retirement age, so 60 to 79 years, we tend to exercise the least, but we need to have those benefits from exercise the most. So we are most frail, we have the most chronic conditions in our lives, but we also, we have other things in our lives going on. We have more work-life responsibilities, or maybe our health isn't the best, and so it's harder for us to engage in physical activity. Maybe the types of physical activities we can do are limited. And so now to kind of orientate you to the other bars, if you look at the two blue ones, you look at men and women, and you see that when we start to think about potential reasons for the decline, you see that women in general across the different age groups are engaging in physical activity less than men. And so, some of the reasons that have been shown are that women experience work-life conflict, so issues in terms of balancing work with life a lot differently to men. When women who have families have to balance, caregiving roles, that makes it harder to engage in things that involve behavior change. And as again with age comes differences in terms of health between men and women. So that's one of the challenges in getting people to be physically active, is just as we experience life, being involved in physical activity becomes harder. So when we think about physical activity at work, just at work, and in what we do at work, we are engaging in less physical activity. And so this is a graph from US-based jobs. This is the best one I could find. I couldn't find, unfortunately, anything from Canada. But this is every decade from 1960 to 2010 in terms of the amount of moderate intensity physical activity. So moderate being, walking up the stairs can be moderate intensity. Walking at a brisk pace can be a moderate intensity. So these activities, but at the job, certain types of jobs that involve, lifting and pushing can be moderate intensity. As we've kind of gone through the decades, we've engaged in less moderate intensity physical activity in the total number of jobs available that have been sampled. One reason most likely for this is that, with increased reliance on technology and mechanization, when we're having more and more jobs involving computers and more jobs involving machines to help us, we're having more of the workforce in front of a computer screen. And while that's helped reduce the likelihood for occupational injuries that come from physically demanding jobs, it's also increased the prevalence of sedentary behaviors and physical activity and inactivity in the workplace, which means which might associate itself with a increased proportion of Canadians, and in this case Americans, who are physically inactive. Now, if I was to kind of hazard a guess as to what it looks like from 2010 to 2020, which is not shown in this graph, I would say that there might be some jobs that are actually increasing in terms of work-related physical activity. I'm thinking of, with an increase in delivery-based online services, say Amazon, Chapters, we're having more and more delivery workers, deliver packages, and so that involves a lot of physical activity and physical exertion. And so there might be a little spike there, but all in all, on average, the amount of physical activity in jobs is declining. So that being said, that's not taking away from the emphasis that many workplaces are putting on physical activity promotion. So when we think about workplace health promotion, there's a lot of different ways in which workplace health promotion can actually occur. We can think about healthy food options at cafeterias, yoga and Pilates classes, mindfulness meditation core classes, and there's at least in Ontario, we have February as Workplace Wellness Month. So, these are opportunities for where the workplace is really trying to support workers in being more healthy in things that are not necessarily associated with the workplace, at least obviously. And the evidence for this is that, there's been numerous studies which show, at least in the long term, and we've been following up workers for long term, find that there have been benefits in terms of providing workplace wellness opportunities to workers in reducing absenteeism, in reducing in reducing presenteeism as well, and just generally healthy worker and healthy workforce means a more motivated and healthy workforce at work as well. So a lot of workplaces are drinking that Kool-Aid and are providing more and more of these health promotion programs. And just as as in cardiac rehab and in clinical populations, the majority of these wellness programs tend to be oriented around improving or increasing physical activity. So again, I mentioned Pilates classes, yoga classes. There'd be fields and access to areas to go for a nice brisk walk outside the workplace. And other things like that. And so with that, physical activity tends to be very popular. It's very well recognized because of the many health benefits that come with it. But that being said, a lot of the workforce are not engaged in physical activity because we know from in general that a lot of Canadians aren't engaged in physical activity. So that really got us interested into seeing what impact can the workplace have in terms of increasing physical activity? Because, a lot of us spend a third of our day at work. A lot of us are engaging in, conversations, in dialogue with people in the workplace, which could potentially modify our behaviors, as well as, the workforce and the workplace kind of really, as we know from other research, can make a sizable impact on what we do outside of work in terms of our fatigue, in terms of our motivations, and so forth. So that's really what I will be talking to you today. So if I was to give you a sense of the different factors as to what impacts whether we engage in physical activity or not, I have to say it's not an easy pitch. It's not easy to really explain unless I really tell you that there's a complexity of different things. And so a model I like to use is this onion. Like it's basically you cut an onion in half, And at the core of the onion, at the very bottom, at the root, are ourselves, our intrapersonal factors, we call them. So it's our motivation, our competence, our own beliefs about physical activity and how it can be important to us. And then cultural norms come here. So, how normative being engaged in physical activity and sport is in our societies, in our families, in our cultures, having role models in our lives and influences that shape our beliefs and values. And I think a lot of times we think that it's just the interpersonal factors that matter. If we shape somebody's motivation, get them to exercise more, they're going to do it. And I think that's where a lot of these exercise programs that I see, coming up, when you see a lot of lifestyle coaches just promoting one aspect of getting people to engage in physical activity, I think that often sets them up to fail when we don't think about other factors. And when we think about other factors, we think about our social factors. We think about who we're engaging with in our lives, in our families. If we find that engaging in sport is a way of bonding with our families, with our communities, with our work colleagues. If there's support from our peers to go out for a intramural sport outside to play softball, to play soccer, if it's something that you do to kind of socialize with your work colleagues, and so those are different factors that can involve the social aspect of influencing physical activity. And then there's our environment. So when I'm thinking of the environment, I could be thinking about the built environment, where we live, where we work, where we play, how accessible those communities are for walking, for running, for playing, our proximity to gyms, to safe spaces, to exercise, to engage in hobbies, access to active transport, the quality of the air around us. We feel like it's comfortable for us to go for walks and for runs, how safe it is. If we feel like an outside environment is not safe for us because of violence, for example, we're less likely to do it. And then in terms of our work environment, how safe is our work environment to feel like we can spend some time doing activities? How comfortable are we to do that around our work environment? And then finally, at the very, the surface level of this onion is policy. And I'd say that policy covers really all of this, in that if we can really impact policy, not only do we stand the chance to really impact as many people as possible, but we'll really address some of the issues that come with equity. That we have to address and acknowledge that not everybody starts with an interest and a motivation in physical activity from the same place because of other factors. We're having to work long hours, having to work multiple jobs, having to think about your personal safety. So all these factors can be shaped by policy, as well as messaging, providing appealing messaging that really addresses some of the barriers that impact a lot of people, as well as making, in the sense of the workplace, making the workplace an environment and a culture where people feel comfortable to seek out opportunities to be physically active, or to think of it as physical activity as being important to their health. So that's when we think about working conditions and the importance of workplace policies in shaping the behaviors of workers. And so I'll be talking a little bit about that as well in this talk. But I'll be mostly focusing on the environmental factors. And so talking about the built environment, also talking about the policy factors, but mostly talking about how we can really address some of the things that we can, potentially, that are easiest to address in getting people to move more. Because, addressing individual behavior can be complicated, especially when we're all so different. And so when we think about the environment and we think about policies, it's less of a one-size-fits-all, but more of certain strategies that tend to work for many people. So I thought I'd start off with a study we published a couple of years ago. And the study asked a simple question, which is, providing workers with access to workplace facilities at or near their place of work, does that increase their likelihood that they'll engage in more leisure time physical activity? So leisure time physical activity being activity outside of the workplace. Will the workplace have provided an opportunity for them to engage in more physical activity outside of work or outside of working hours? So when we were looking at this, a lot of the work I do looks at research at a population level among many, many people. And so we're looking at surveys and other types of data that have been collected on a large sample of the population, and we found one. And this was offered by the Canadian Community Health Survey, which is administered by Statistics Canada nationally and across provinces. And this particular survey, so this survey is usually administered every year, every other year. And this particular survey was a one-off in that it asked all respondents at or near your place of work, do you have access to one, a pleasant place to walk, jog, bicycle, or rollerblade? So kind of addressing opportunities to active commute as well as just go for a stroll. Two, playing fields or open spaces for ball games or other sports. Three, physical fitness facilities, a gym. Four, organized fitness classes, thinking of our Pilates, yoga. Five, organizational recreational sports teams. Six, showers and change rooms. So this could be popular for people who are looking for places to get ready for work after maybe biking, or getting ready for work after taking a physical activity break in their lunch break. And seven, programs to improve health, physical fitness, or nutrition. So, this was really addressing all the different varieties of potential opportunities to engage in physical activity at or near work. And so that, to us, that spoke to access to these opportunities for workers. And so we looked at a working population in this survey, and people who said that they were self-employed. We didn't look at them because we thought that we really wanted to see the impact of the actual work environment rather than the home environment. So we looked at a specific employed population who were working and were working at the time that they filled in the survey. And we had about 60,650 responses to work with. And so this table looks a little busy, but I'll try my best to explain it to you. So in the table, you look at each column, and each column in green shows groups of people, and the numbers are basically the probabilities that they responded to having the different facilities. And so the facilities being on the left-hand column, pleasant place to walk, playing fields, gym, etc. And then having all of those facilities would be in column one, the all column, where they all had a reported with a very high probability. And I'm not going to go over the methodology unless you ask me later, but these are just the likelihood that they would respond to these. We just divided everybody to different groups, and this is the likelihood that they responded to having these facilities. And at the very bottom row, the percent of all respondents, that's out of the 60,650 survey respondents, what percentage reported having these different facilities? And we clumped them by their likelihood of being reported. So we looked at combinations among those respondents. And so this was just the profile of what people reported. And what's interesting is that the very right column is having nothing. And that's what we expected there to be more than 24%. There's 24% reported. We thought there'd be more people who said they didn't have anything, just simply because we know that Canadian workers are not engaging in as much physical activity as we would like. But it's sizable, but not a huge proportion, or not the overwhelming proportion of people who have no facilities available to them at or near the workplace. Now, at the other end of the spectrum is having all of these facilities available to them. And so that's 24%. So similar amount to the having none, and which is interesting. And I think it's probably because having people read these, these questions, think about whether they have these facilities to them, they're probably thinking, aha, yeah, maybe I do have opportunities to engage in physical activity around the workplace or when I'm at work. And so it just turned out that a good proportion reported having everything. And then, you have groups 2 and 3 following. So 2 being having a pleasant place to walk and playing fields, and 3 being a pleasant place to walk, access to a gym, fitness classes, showers, changing rooms, and programs to improve health. So those were the most populous groups, and as well as having group 5 having pleasant place to walk and showers. So with these groups, we thought it would be interesting to see, we've now classified types of combinations of facilities available to Canadians among a pretty sizable proportion of the population. We've also extrapolated this proportion of respondents to the Canadian population. So this was all representative of Canadian employees at that moment in time. And we thought, among these different combinations of the workplace, how likely are they to engage in leisure time physical activity? And so what we did was we looked at the relationship between these different facilities with engaging in physical activity outside of work. And so I'm going to explain what this graph means, but essentially what we tried to find was this relationship. And so on the right is what we call a forest plot. And for those of you who aren't familiar with what a forest plot shows, essentially it's a graph showing how likely each of these combinations, so if you go through each of these rows, the rows being the different combinations of facilities that are available to people, what they reported, how likely they were compared to not being to having no likelihood at all, which is 1.0, which is basically the which we allocate with that dotted line. Anything to the right of that dotted line means they're more likely to be engaged in physical activity in their leisure time, or to be physically active. And when we define being physically active as meeting the physical activity guidelines of 150 minutes of at least moderate intensity physical activity. So, for example, to the right of the first row, combination 1, you see that the diamond is all the way up just past 2.00. And so they're 2 times more likely, or 200% more likely to engage in physical activity in their leisure time if they report having all combinations of workplace facilities available to them in their workplace. And so I should also mention that we assessed leisure time physical activity by everybody reporting their activities in different, their engagement in different activities. So walking, jogging, biking, engaging in, say, skiing, bowling, all the different types of things that people could be doing in their leisure time. Well, a good number of things that people could be doing. And we added them all up, the amount of time they spend, as well as multiplied that by the intensity of activities to figure out if they were meeting their guidelines. And so it seems here, you see every number is to the right side of that 1.00. If it had been at the left side, if it had been minus, then we would say that they're less likely. But everything's to the right means that they're more likely. Everything is ranging from about 150% more likely to 175% in the case of combination 3. So on the surface, just looking at this graph shows us that providing workplace facilities can be really effective in getting people to engage in, at least there's an association between engaging in physical activity outside of work by having workplace facilities available to them, right? But then I guess if you were being cynical or being if you were to criticize what I've been telling you, you would say, hey, wait a minute, these are people who are probably likely to engage in physical activity anyway. If they have a lot of facilities, they're probably in a workplace which really values activity, and they're probably going to look for those jobs as well, apply to them. And so these are the most engaged in the population and are probably likely to be physically active anyway, right? And so what we did was we then we did some statistical things, but at the heart of the statistical things we did was we looked at all those people that reported physical activities that were plausibly related to these facilities. And what I mean by plausibly related, I mean, if someone reported that they skied a lot, then it's less likely that that's because they had these facilities available to them. But if they reported walking a lot, and we adjusted for a lot of different variations, so adjusted being we control for a lot of other factors by age, by their sex, by where they live, and other factors. If they reported walking a lot, it's more likely that it's more likely it's related to having a pleasant place to walk at or around where they work. Bowling is another example. If they had a bowling facility, that's less likely to be associated with these facilities. So we really looked at those things that are plausibly associated with these facilities. And what we found was interesting was that 3 of those groups actually fell off the statistical significance chart. What that means that they suddenly became, the signal that they provided in terms of the impact of their association with workplace facilities and leisure time physical activity suddenly dimmed. The signal wasn't strong enough or wasn't convincing enough to tell us that they were more likely or less likely to be physically active. But 2 combinations, the signal still remained. And that's having all combinations available to them it's combination 1, and having number 4, interestingly. So the minimum being a pleasant place to walk, showers, changing rooms, and health programs. So that was interesting to us, and that these two seem to show that there was an association with leisure time physical activity that the others still didn't show if we look at really the ones that are plausible. Now, that's all rosy and great, but there's still 24% of the population that we sampled that don't have any access to workplace facilities, and even more if we think about those who have only a few facilities available to them that they may not be using. And so we found a certain group stood out to us if we were to just characterize what they looked like, those people who had the fewest. These were mostly racialized people, so were not Caucasian in the survey, or reported not being Caucasian, had low income, low education of having either secondary school, high school education or less, a recent immigrant, being in a very physically demanding job and working long hours, so more than the typical 40 hours per week, and self-reporting, so saying that they felt like they had generally poor state of health and poor mental health. And so when we were reflecting on this finding, it told us that we may not be reaching the people we want to reach the most, because these are people that tend to also fall through the cracks when it comes to physical activity, health promotion in general. Think about these people. They're generally people of low socioeconomic status. And with that comes other issues outside of work. Comes with, these are the people who have the poorest built environments to go for walks, to feel safe, to have access to gyms, to have access to play areas, have demands in their personal lives that make it very difficult to engage in physical activity. And so it tells us that one way to look at it more pessimistically is it's a double whammy. It's a little sad that the people that need to have the benefits the most from these workplace facilities are maybe not having these facilities, or their workplaces are not providing them with these opportunities. Maybe these are people in precarious jobs, in low-paying jobs with fewer facilities. But it could also be that they're also not having these opportunities outside of work. On the flip side, it also tells us that more and more that it's harder to change what people are doing outside of work. It's a lot more involved, but if we can change what people are doing at work, we might have an opportunity to allow these people to have more of a chance to engage in more physical activity. So just kind of a little bit of a segue in terms of facilities, I thought I would address another hard to reach group, which is the older population. An older population being people who are approaching retirement. And so, not approaching middle age to approaching retirement. And so I just briefly share this study, which is kind of piggybacking off the survey that we use of 60,650 respondents, where we just looked at those who responded having showers and change room facilities. Actually, we looked at a different number of different facilities, but we looked specifically at active commuting and shower change facilities. And we found, in terms of active commuting, people who bike or walk to work, what do these people look like, and how likely are these facilities to increase or decrease their levels of biking or walking to work? What we found interesting was that older workers compared to younger workers, so these are workers between the ages of 50 to 75 years of age, were more likely to bike to work if they had available to them a shower or a change room at their workplace. And that was interesting to us. And we found that this was, the other relationships weren't as strong as what we found for older workers. And this group of older workers were also more likely to bike over short and long commutes to work than any other age group. So it could be that having showers and change rooms available to them might make it easier for these individuals to feel comfortable that they can change into more work appropriate clothing and engage in work. That they might have roles where they have more autonomy over their jobs, being older, that they can be comfortable to do that, change into their work attire than maybe younger workers. And so this is an interesting finding that has been backed up by other research, but just shows just the potential of workplace facilities among hard to reach groups. And we've said that older workers are people who generally have lower physical activity levels in general. So in summary from those two studies, we find that some combinations of workplace facilities are likely than others to help workers increase the physical activity outside of work. And so we think of all the different, having all facilities available to them that was asked in the survey, as well as having showers, changing rooms, and health programs, were to us effective in increasing leisure time physical activity. If I was to say why they were, why having all facilities was effective, it could be that providing more options to people means you're getting more people to do what they prefer to be doing, and you know, when we think about activities outside of, you know, activities that involve sports, you know, that could mean people, when you think of activities outside of, including sports, a lot of people might shy away from that and prefer to do things which involve individual physical activities, say your Pilates classes and your yoga. And when we think of showers and changing rooms, we've shown in the other study that that could be effective for certain demographics as well. But then, you know, we can see that there are some people get left out, and these are people generally with lower socioeconomic status related factors and demands that come from outside of work. And so maybe the way to go, and this is research that I'm looking to do, you know, progressively in my career, which is to really understand how to get the people who aren't engaged in physical activity outside of work and don't have the facilities at their workplace to be more involved in physical activity. And lastly, I should mention from these two studies, there is a caveat in that we specifically looked at access to these facilities. So these are natural combinations of facilities at around their work, and if they had access to them. This was a cross-sectional moment in time survey, so we looked at one moment in time, and we think with future work, we could see how engaged people are in these facilities and how engaged they are over time, so following them up over, you know, different periods. Unfortunately, we didn't have access to that in that survey. We'd be interested to see if I'd be interested to see if they, in fact, engage in these facilities over time, and if they continue to engage in them, and if that increases their physical activity consistently. So I've talked about the facilities around work, but another type of environment is our workplace itself. And I thought, you know, it'd be interesting to see how our working conditions can shape what we do outside of work. So think about our working conditions being, you know, the stresses we feel at work, the type of work we do, the amount of time we spend at work versus the amount of time we have available to us outside of work. And so the question that I asked with my team was, if we were to look at changes in working conditions, if our working conditions change, and not just in one point in time what those working conditions were, but if they changed over time, would that lead to a change in our, would that be associated with a change in our leisure time physical activity, what we do outside of work? So kind of give you a bit of a primer as to what I'm getting at with this, is that our working conditions often impacts our physical activity positively and negatively. And so this is a model to really help conceive some of these constructs. And so the two boxes on the right are our physical activity and our health and well-being. You know, physical activity, if you engage in more of it, you're healthier and you improve your overall well-being. But there are factors that determine how we engage in physical activity. So above physical activity, you see this self-regulation, our ability to kind of motivate ourselves, to regulate our sense that we have time available to us to engage in physical activity outside of work when you come home, and our feeling of self-determination. So our sense of, you know, our intrinsic motivational factors that really help drive us, to kind of push us to get us off the couch, to push us to kind of go to the gym, take a drive to the gym, or go for a walk or go to the park. And really, and how these are kind of related to work, a lot of research, and so this work was really a summary of a lot of the prevailing research, which shows that, you know, having a demanding job can mean that we can impact our ability to self-regulate our motivation, or self-regulate our perception of having time available to engage in physical activity. So having more things to do can impact our stress levels, can impact our psychological health, can impact our physical health, and then that brings in fatigue, can bring in stress, and then that impacts our self-regulation to a point where we may feel like we have less time to engage in physical activity. The other end of the coin is a control, job control. So if we feel like we have less autonomy in our jobs, we might have, we have people we have to report to, we feel less free to be able to make decisions in our job. That has been shown to show that that can negatively impact our motivation. And so that is linked to a lot of the jobs which we sometimes associate with blue collar work, or with jobs which we involve precarious work and jobs where people don't have a lot of say. That can impact our behaviors, and that comes negative perceptions of leisure time physical activity. Then on the flip side as well, we have more control and we have fewer demands. That impacts our determination, regulation, and we have more opportunities for physical activity. So, we think of these things. We did another analysis of a survey, and we looked at the National Population Health Survey, and this was another survey offered by Statistics Canada. This time, we looked at a starting point of over 17,000 people, and we looked only at employed people who are not self-employed, so only looking at the conditions of a typical workplace setting, and people who were not in part-time work, but working for at least 15 to over 40 hours a week. And we looked at these people, and what was interesting about this particular survey is that they were first surveyed in 1994, and then they were followed up every 2 years for 12 years. So we could see how their work conditions changed, as well as their physical activity might have changed. And so we looked at specifically we used some statistical ways to do this, but we looked at people who reported a change in their physical activity at one of those survey time points. So the surveys was administered to the same people every 2 years, and if they reported a change in their physical activity, so whether they were moving from inactive to moderately active, so kind of moving more, doing more, spending more time in physical activity, but not up to the point of being meeting the physical activity guidelines, or moving to completely active, which is meeting the physical activity guidelines, we looked at those people. And we looked at those people, and we looked at whether those changes in physical activity were associated with changes in working conditions by controlling for all the other things that make us different. So that's a mouthful, but essentially the working conditions we looked at were some of the things I described in that model. And so some of those things being our ability to learn new things, that if our job requires us to learn new things, what we call skill discretion, if it involves a high level of skill, and if our job requires us to do things over and over. If we have decision authority, if we feel like we have freedom to decide how to do your job, if you have a lot of say about things of what happens to you in your job, so that a job that I do, I feel like I have a lot of freedom, but somebody else in a job where they're reporting to a lot of people and they only have a very limited job skill, job requirement, they may feel like they have less say in what they do. We also looked at psychological demands. If they feel like there's a lot of strain in their job, if their job is very hectic, they feel like there's a lot of conflicting demands or not. And then if their job was physically demanding, if it requires a lot of physical effort. And we also looked at if they had multiple jobs. And so having multiple jobs, in theory, would seem that if they're balancing a lot of work, they might have less time to engage in physical activity. And then more time at work. There was a question on how many hours a week they spent at their job typically. And so the more time at work we thought would maybe take away time for doing things involving healthy behaviors. And then we also looked at shift schedule. So changes in shift schedule. People move from regular shifts to other types of shifts. So rotating, switching from night shifts to day shifts, or people having on-call shifts. We think of healthcare workers or people in irregular shifts. So we looked at all these conditions, and we tried to see if these changes in these work factors were associated with changes in movement. And so in our sample, and I mean a very specific sample of people who changed, these are the people we looked at. So mostly, it was a good mix of men and women, mostly working full time, on average about 35 years old, mostly married or in a relationship, mostly without any children, having a high school education or less, mostly Caucasian, and living in the urban areas, and mostly reporting in 1994 that they were inactive. So at least half the population were saying they were inactive versus moderately or very active. So what do we find? And I'm going to go through this a little fast so I can invite more questions, but it's really the same type of diagram as I showed you earlier from the previous study. But this is a forest plot, and what they show, and I've just highlighted in brighter orange, is that for each of these groups, so we look at, in this particular graph, it shows people transitioning from being very inactive to moderately inactive. From each of these groups shows how likely they were to move to that transition. So how likely were they to move to being inactive to moderately active over time? And we find that there were three groups that really popped for us. There was the lower skill discretion group, so those who had less opportunities to really use their skills and felt like they weren't using a lot of their skills at work. The higher psychological demands group, so people who felt like they had a lot of demands at work, psychological demands, a lot of stress, a lot of strain, and so that really impacted their physical activity outside of work, as well as people who felt a lot of physical demands. So maybe that had to do with fatigue, feeling a lot of physical fatigue might have meant that people were engaging in less physical activity outside of work. Now, for the other factors we looked at, none of them showed any kind of signal that made us curious. They were all statistically insignificant. And we found the same relationship from transitioning from being inactive to mostly active. And so again, those three groups really popped up, which shows that maybe these are areas of the workplace that we need to really think about. How stressful work is, how much, and skill discretion is also related to stress or ability to feel, to feel valued. And then physical exertion, how demanding physically work is. So then, in summary from that study, we find that working conditions, those three that I just presented, can present barriers to physical activity. So skill discretion, having low skill discretion, having a physically demanding and psychologically demanding work environment can be hindrances to physical activity outside of work. But then on the flip side, if we address these things through policies, effective policies that can help alleviate some of the stresses that come with work and understanding what those stresses might be, maybe allowing workers to take breaks so that work doesn't have to be as physically demanding, then maybe we can have a positive impact in what people are doing outside of work. And I didn't mention this in those graphs, but our barriers and these findings were the same or similar for between men and women and among older and younger workers, showing that these conditions are likely similarly felt by and equally felt by these groups. So men and women might be also feeling the consequences similarly of what's happening from work, irrespective of what they're doing outside of work. So recommendations, what can I recommend to you? And I've kind of tried to recommend a few things. Now, what's important to keep in mind is that I normally don't, and I stay away from giving you a one-size-fits-all recommendation. It's rather to think about what works for you, what works for your employees, what works for your colleagues. And so if I was to say a simple message, it would be, make sure that you and your employees are happy, engaged, rewarded, and productive while at work, and you're more likely to engage in physical activity outside of work. And on the flip side, if you engage in more physical activity outside of work, you're more likely to stay happy, engaged, rewarded, and productive while at work. So, they help each other out. But in order to do that, you need to understand and address some of these barriers that impact the physical activity of your workforce. So addressing the stresses and strains of work, and that comes through supportive policies, creating an environment and a culture at work. And this might start from the leadership and where leadership which values physical activity and the overall health of the worker. And by providing supportive workplace policies, that should allow more workers than you think in engaging in physical activity in their daily lives. So policies is where to start. Policies can be hard to change, I know that. Policies involves a lot of work, but so do changing the environments as well. But that can also be somewhere to start. Ideally, you'd want to impact both, but policies and supportive workplace environments are the way to go. But if you can't impact policies, maybe think about areas where you can provide opportunities for people to engage in physical activity while at work, especially for those people who may not have opportunities outside of work to engage in physical activity. So that's all for me. I'm happy to engage with any questions that you ask here today. And if you come up with questions afterwards, feel free to email me or tweet at me as well. My details are there. So thank you very much.
Thank you so much, Avi, for this extremely compelling and much needed presentation. We can move to the Q&A session if you don't mind. And to our audience, if you have any questions, please insert them in the question box. So the first question is, in slide 3, you have shown us a graph of the average, moderate, vigorous physical activity levels of Canadian adults. Is it recommended for adults to have physical activity of moderate to vigorous intensity on a daily basis?
Yes, I would. Well, it's always recommended to be as active as possible. Active, and I think the message it's generally the message is changing. So initially, it used to be a hard message of being at least moderate to vigorous intensity will give you the most benefits for health. And so doing as much of that as possible. And so, you know, of course, that's hard for everybody. And they've worked on a number to provide people with a number. So they say, you know, 30 minutes a day for most days will get you to 150. Now, 150 again is arbitrary and very hard for a lot of people. So more and more research is also saying that, you know, walking is good too. So walking may not be, will be a moderate intensity activity, but it may not be as brisk for a lot of people, but it's something. And so I'd say it's recommended that people move as often as possible. You know, they say 10,000 steps is a good guideline, 150 minutes is a good guideline, but just trying to do as much as you can every day.
Perfect, thank you.
Yeah.
Perfect. Second question is, in terms of overall solutions, how can workplaces effectively promote, encourage, and motivate Canadians to practice more activities at work and outside of work?
Yeah, it's a good question. So I was kind of alluding to some of those things. So I think some of the work that I've done outside of these studies are that workplaces, the changes that happen in workplaces happen oftentimes because of leadership, effective leadership, and leadership that are willing to, you know, take risks to experiment and involve, you know, these strategies. So involve opportunities for workers to be more engaged. So we call these, you know, vanguard employers that are, you know, that we see as notable for, you know, engaging in more of these things. So, you know, having more workplace facilities available to the employers. So that could be one way. And they're the people that promote a culture of health, that where the health of employees is kind of, you know, really, that message is really instilled throughout the organization in the corporate business plan. And that's one way to really instill this change. Another way is to get champions involved. If you have people in your organization that are really speaking towards the value of more physical activity opportunities, then those people can really not only convince leadership, but can also, you know, get more people in the organization to really speak for these opportunities as well to be provided. And so these are some ways. And you know, with policies, if there's a general sense, you know, in certain jobs that this is important, I think it's important to kind of raise awareness and education. So I'm not giving you a simple answer, but what I'm saying is that it really requires involvement of both hierarchy and from the bottom and the top of an organization to really get change.
Makes sense. Thank you, Avi. Next question is, how does the physical activity of employees correlate with their productivity in the workplace?
So that's also a good question, because I didn't show that finding, but I said it. And the reason I didn't show it is because it's the research out there is a little messy. And so in general, the studies that have looked at productivity and presenteeism, and we think of presenteeism as people who are at work but not feeling well and not really participating on the job as they normally would, as well as absenteeism. We find that the best studies, and the studies that really looked at people over long periods of time, or looked at, you know, worker compensation evidence and things like that as outcomes, we find that in general, worker physical activity is, so those who are most physically active have the lowest amounts of reported presenteeism, reported on the job injury, the lowest risk of chronic conditions. And so in general, it's a very positive thing, and productivity comes hand in hand with those health benefits. And so in the U.S., there's been a real push. We call this a movement, the total worker health movement, and there's been a real push for promoting more physical activity in workplaces alongside safety. So being a part of the overall occupational safety and health strategy, because worker productivity is so benefited. So there's several studies, and I'm happy to email them to you if you email me.
Yes, we can definitely also link to them on our website on the webinar webpage. Perfect. The next question is, to the best of your knowledge, are there any successful programs implemented in workplaces that successfully support physical activity within the workplace?
So I can't unfortunately give you Canadian examples. I've only looked at these things in a very population level, so just numbers among representative of all workplaces in Ontario and in Canada. But I am familiar with some of the evidence in the U.S. There's been a push in the U.S. because the U.S. U.S. employees tend to pay more for health benefits because it's not a nationally supported healthcare system there, in the same way that it is in Canada. I mean, it is, but it isn't as well, and it's very politically charged. And so there are a few examples, and I'm thinking of big employers. So we often find large employers. I'm thinking of examples like NASA, thinking of GE, thinking of other organizations that have, there are case studies available. Again, happy to share them with you, where they have implemented strategies where they've really provided lots of opportunities for workers to be physically engaged. And with that, they've had positive feedback in terms of not only how employees feel, but also in terms of how the markers for health that we call, like, their cholesterol levels, their blood pressure has been reduced, and things like that. So a lot of case studies are coming out from the U.S. that I know of. Yeah.
Thank you, Avi. Next question is, how can employers promote wellness and physical activities for teams working remotely?
That's a good question. I can't give you that answer right now because it's such an important question, especially with what we're facing now with this pandemic. Many of us working remotely. I would say really it's about, if I was to give a guess, and also just from my own experience now having to live, with my work and life being blurred, I would say making it clear to employees that it's okay to take breaks, providing messaging that physical activity is important for health, it's something to do, and that it's something to do that is beneficial for you, and providing that messaging, making it clear, giving opportunities for workers, but also making it clear to management and leaders who in the organization who make that possible for workers, that this is important because it will give them a benefit in the long term. A healthy workplace is a healthy workforce is a healthy workplace, and also derive lots of benefits for the workplace in general. So it's about that messaging kind of instilling throughout the organization, and making it clear that even though you're not in a typical work setting, that it's important more than ever to take a break and go out for walks and to use the facilities that you might have available to you to be physically active.
Thank you so much, Avi, for this relevant answer, especially in these times where we're all facing the situation worldwide. The next question is, what kind of accommodations can workplaces easily implement to encourage people to engage in physical activity at work?
Yeah, so I mean, I think it's about providing something. Something is better than nothing, right? And there's two ways to think of this. Something is better than nothing, but providing more options means you get more people interested. So I can't say what exactly. I've shown an example in a study where it might be that providing health promotion programs, showers and changing rooms, and fitness classes, maybe opportunities like those can give people, a very type of worker engaged in physical activity. But I think my sense is you give more opportunities for people in varied activities or things that engage a lot of people in different ways. Those people more people will engage. And so, I've mentioned facilities, but of course we need to think about policies too. So there's been some research on providing breaks, and if you provide people breaks, they're more likely to then use those breaks to go for a walk, if those facilities are available to them, or attend that health promotion class, that Pilates class.
Perfect. So we're arriving at the end of this webinar. Thank you so much, Avi, for describing the challenges workers can face in participating in physical activity outside of work, and for shedding some light on key components of occupations that can facilitate leisure time physical activity levels. And to our to our audience, thank you for your participation and continued support. The recording of this webinar will be available on our website within 2 weeks, along with the slides. All registrants will receive a notification email when these items are available. Immediately following this session, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars as well as suggestions for future topic areas. Our next webinar is titled Return to Work Among Healthcare Workers Injured Due to Workplace Violence. Please visit our website for more details at workwellnessinstitute.org and register for free. All of our webinars are accessible to the public. Thank you again for accepting to be with us, Avi, and thank you to our audience for your participation. Stay safe and take care of yourselves. Bye-bye.
Bye. Thank you.